Good evening. Today we'll be looking at the different forms of multimedia assessment in medical education. Hi, my name is Francisco Cano, and this is for Liberty University's Education 734 Implementing an Assessment of Multimedia Learning Tools with Dr. Abraham. Some of the objectives we'll be looking at for this presentation are we're going to discuss the purpose of multimedia in education, but more specifically, later on, we will look at medical education. We're going to discuss the purpose of assessments. We're going to look at the different types of assessment tools that can be used in both education, but again, more specifically in medical education. We're going to talk about the differences between assessment and evaluations. We're going to discuss the use of computer-based training as a form of an assessment tools. We'll look at the different assessment forms that are available in medical education, and then we'll conclude the training by conducting a review of everything that we have learned and discussed throughout this session. If you have any questions, please feel free to ask during the presentation. What is multimedia? Well, multimedia is used widely in today's education, and it helps both the teachers and the students get a grasp of what is being presented and taught. Multimedia is defined as a combination of more than one media, which can be in images, pictures, audio, video, text, symbols, or in animation. But more specifically, multimedia is used as an aid of technology for the purpose of enhancing or memorization of an item or a product. So what is the purpose of multimedia in education? The main purpose of the use of multimedia in education it is to encourage our students to learn using various different types of methods using multimedia, which can take the form of video, audio, or a combination of both. You can combine all forms of the multimedia so the benefit of each can be used in a desktop environment that will bring together both your hardware and software. So it does not necessarily have to just be one form. The biggest benefit also is that it reaches all the many different learning styles by using a variety of methods in which the contents is set by the learner so that it can be able to be retrieved, retained, and applied. And when we discuss the different learning styles, we want to place an emphasis on your visual learners, your auditory learners, and your tactile learners, and those that learn with all the different methods mentioned before. We will also discuss and state that multimedia can be used to assist the memory system in order for new information to be moved from short-term memory into long-term memory through maintenance and rehearsals. So what does this mean? It means that the more that we review the material, the more we'll be able to recall that information, especially when we do hands-on skills demonstration. If we practice how we're supposed to conduct an item or an assessment, the student will be able to perform that flawlessly if they're able to face with that same situation. What is an assessment? An assessment is a tool that refers to a wide variety of methods that educators can use. Assessments can be used to evaluate, measure, document, used to look at academic readiness of a student or group of students. It is also used as a learning progress, so you can see where your learning has improved throughout the semester or the term. Also, an assessment can be used as a skills acquisition, and it can be determined as an educational need of the student. For example, if a student needs additional training or they are special needs and they are not able to comprehend things as easily, or they might speak a foreign language. These assessment tools or these assessments can help place a student into the right course that they might need for the year. And it can give them additional resources or assistance that they may require, like, for example, an educational 504 plan. It is also used to check the content for accuracy, clarity, creativity, purpose, but most importantly, you need to make sure that you are paying attention to any copyright considerations and you give credit where credit is due. There are many different types of assessment tools that educators can use when it comes to conducting an assessment of a course or a training. You must select the best type of assessment tool that you want to use based on what learning outcome you want to observe in your students. So what does this mean? If you're looking at doing an assessment on speed, reading, and comprehension, you go ahead and you time your students on how fast they can read through a paragraph or story, and then you ask them questions about that story to see their retention instead of just giving them pictures and then trying to decipher what they just saw. One of the forms of assessment tools that we have are standardized tests. These standardized tests, they're designed and developed by either a company or a group of faculty or staff that decide whether or not they were going to provide certain or create certain standardizations for a general group or population to determine what should have been learned throughout the semester. It is used to determine the level of knowledge or skills that the students must have or should have achieved during a certain time of the year or at the end of the year. And standardized tests are used to evaluate the students' comprehension skills based on analyzing texts and readings. Another form of assessment tools are your computer-based tests. Computer-based tests is a media technology-based form of assessment tools that can be linear or adaptive in the manner in which the examination progresses. So what does this mean? A linear test basically examines the full length of the exam in which the computer selects the different questions for you without consideration of the performance level for your student. Or the computer can select a range of questions based on your performance level categorized by content and difficulties. So what does it mean if it's linear or adaptive? If a test is linear, it's going to have the standard 1 through 50 questions that it will give. And sometimes it might select or from a bank of questions that matches what you want to evaluate. Or in the adaptive, it can start from easy to progress to hard questions. And your student may not get the full 50 questions based on how successful they are at answering the questions. So this means that the student may only get 25 of the 50 questions, and those 25 questions could dictate whether or not they mastered the items. If they go through the entire 50 questions, in certain situations, that means that the student might have mastered the subject, but they were weak in certain areas. And when it comes to computer-based testing, they're scored in the same manner as written tests, although in certain programs, the student is penalized if they leave any unanswered questions, and points are deducted. Another form of assessment can be formative assessment. Formative assessments are used as an in-process assessment tool that the students to focus about the students from what they are learning and what they are not learning. It is based on the performance of students, where it can be a chance for a change in the instructional approach, selecting better teaching materials or better teaching manners or forms, and in your formative assessments, it can help uh, basically determine if the student might need any additional academic support assistance, like having to go to a tutor. Usually, formative assessments aren't graded, but a form of it can be as quizzes or in-class discussions with your students. That's those are some of the different variations of formative assessments. Summative assessment. Summative assessments are used to evaluate student learning at the conclusion of an instructional period. So, for example, it can be done at the end of a semester or the end of a term. They're based on test scores from reading assignments, homework assignments, and projects and tests that were given throughout the semester or the term. Performance assessments. Performance assessments are used to evaluate the student's work produced by the student to show what they have learned, what is expected of them to have learned. So, for example, you tell them the performance assessment means how to use a fire extinguisher. They will be given a fire extinguisher and they have to be able to demonstrate those skills. These can be done as skills assessment, or they can be scenario based or through exhibitions. Basically, see one, teach one, do one. Assessment versus evaluation. So, what does it mean when we evaluate something? And what does it mean when we conduct an assessment of something? When we conduct an evaluation is making a judgmental or making a determination of something concerning based on the quality of the performance, the work product, or the use of skills against a set of standards. So we evaluate performance. That's the best way to think about how we use the evaluation process. Meaning, if they successfully met all the requirements to get 100 versus if they did not meet the requirements to pass when it comes to, for example, food safety. Again, it is based on points. Evaluations are designed to document the level of achievement that has been attained. For hospitals, evaluations are done by a joint commission. When a joint commission comes and verifies that everybody knows certain regulations and everybody is conducting the patient's skills and has the required competencies for their jobs. Assessments. So when are we going to perform assessments, and what do assessments do? Assessments basically focus on measuring of performance, work product, or skills in order to offer feedback on strengths and weaknesses. It provides direction for improving future performance. They are supposed to be non-judgmental and are designed and intended to be used to produce improvements. So as an educator, what are some of the multimedia tools that we can have our students use for assessment? And what are some of the stuff that we can go back and review with them to see if they've gotten a grasp of what they've learned? One of those things can be giving your students some type of social media post assignments. There was a study in which, for students that did not speak English, they were told to look at items on social media, for example, Facebook, and write comments on it. And the outcome of that study showed that students improved their English skills, especially when it came to writing, by looking at certain social media posts and commenting and writing about those social media posts in their lectures. Another form where you can have your students assess is by having them create blogs. With the creation of blogs, basically it allows the students to pick a topic and discuss that topic. And you can evaluate that topic based on if they met the criteria for the items that you wanted them to discuss. You can have them create timelines. You can have them create maps. Also, you can have them create certain reenactments. You can have your students create audiovisual recordings of a lesson plan or a lesson that you want them to teach. They can also go online and do an online exhibitions. For example, if you want them to create a presentation, like they were giving a TED Talk, you can have them tape it and you can view it. Another form of assessment tool is you can have your students create websites. Currently, there are many different sites out there where your students can go in for free to create a website. And more specifically, though, you have to give them a certain assignment on what type of website you want them to create and what the contents that you want to assess. And then the last form could be in forms of case studies. In the world of medicine, for medical education, a lot of the doctors, they review different cases and they discuss those cases uh, to see if treatment or care of this patient could have been different, especially if that patient had a negative outcome. That is one way on how doctors are able to conduct improvement of their skills and abilities. Well, one of the ways that we can use technology is through computer-based testing programs. Computers are great, but at times they're only as good as the programmer themselves. So what does that mean? That there might be times where the computer itself might fail. Students might be halfway through an exam and all of a sudden they freezes and it wipes out all of the information. Then it might not allow the students to go back in there and restart their tests. But at the same time, the use of computers when it comes to computer testing may have a lot of pros. So we're going to go over the pros and cons of using computer-based testing. When it comes to computer-based testing, one of the biggest and number one answer why instructors or teachers enjoy doing computer-based testing is the ease of administering the tests. All you have to do is have your students log into a certain website or a certain link and have them start their exam. The computer automatically can start a timer while the student is taking their exam. To include, there are certain exams where each question has a certain time limit in which the student has to answer it. Another reason why computer-based testing is enjoyed by teachers is basically the ease of grading. Once the student is done testing, they finish their 50 questions, the student most of the time will be able to have real-time results being shown, and they will know whether or not they pass the test as soon as they finish the 50th question and they hit submit. They'll get a score based on the number of questions they answered correctly versus the number of questions they answered incorrectly for a percentage. Some of the computer-based tests are also easy to update. So the ease of updating, what does that mean? It means that the instructor can go back into the program, change the question, or modify the order of the question, or completely erase the test itself and do a newer version of the exam, just in case your students have decided that they're going to copy the test. With computer-based testing, you can also use it to measure skills. Students of certain economical backgrounds may find it easier to use than those of lower income families. Computer-based testing can also positively impact teacher evaluations. They can impact the school's accountability. They can also impact or affect the distribution of resources, and computer-based testing results can influence where families live based on school performance. Well, just like there are positives, there are also negatives, especially when it comes to computer-based testing. Some of those I mentioned before, where your student is taking the test and all of a sudden they lose power or the computer freezes and now the student cannot finish their exam. Or if they are able to finish their exam, they have gotten penalized because there was something wrong with the system. And now the student may have to take the test completely from the beginning. But here are more cons. Students of low family income or low income basically may not be able to get the technological resources, or they may not have the money, which may not allow them to purchase computers, so they may not be as computer savvy when it comes to the use of computers. So during testing, you know, if one of the questions has a drop down menu, they may not be able to figure that out because again, they don't have the computer knowledge and computer savvy as some of their peers might have. Some of the students aren't great test takers. That can be true for both computer-based tests and for written exams. But 9 out of 10 times, if a student is taking a computer-based test, some of them are going to have higher anxiety and may not perform as well as if they would have taken a written test. In one of the studies, it showed that two students were given the same test and they were from the same type of background, had gotten the same knowledge, and the student who took the written test performed 3.4 points better than the student that had taken the same exam but on a computer. Sometimes certain computer testing programs may not work great on children with disabilities, whether it comes to hearing difficulty or seeing difficulty. Some of the students may be flagged for retention or not allowed to advance based on their score. They may say that they did poorly when they knew their stuff. So now the student has to repeat the 5th grade based on those results. Computer-based tests, instead of measuring the skills for testing, it may also measure computer literacy. With students of special needs, same thing. It may not provide the proper feedback for them and may say that the student does not need special education program, or it might put the student in a special education program that does not need the special ed program, or it might even remove that student that was gifted from the program, or it might put a student that's not supposed to be in the gifted program into the gifted program. It can also affect students whose primary language is not English, which means that they have a harder time taking their tests. Poor test scores can definitely affect teacher evaluations, and it may affect the amount of resources that the schools gets, which may result in those schools that aren't performing well either being shut down, teachers being laid off, and those schools not receiving the proper funding that they need to upgrade their equipment. For the medical world, for medical education, there are a couple different assessment tools, assessments that we can do. Primarily, in most assessments, we're testing the cognitive recollection. But in the medical assessments, we need to look at the analytic, the communication skills, we need to look at their interdisciplinary care aspect, counseling, and we need to look at evidence or system-based care. These are all the aspects that we're looking at whenever we're evaluating our medical students, our nursing students, our techs, or our providers. One such assessment tool that can be used are called OSCEs, which are Objective Structured Clinical Examinations. These consist of multiple stations where the students are asked to perform a desired task. They are designed to measure outcomes and allows the evaluator or the assessor to be able to provide very specific feedback to the scenario or specific case studies. They are given tasks. For example, they're asked to obtain the patient's focus history, They are able to perform a focused clinical examination of a particular system. So, for example, if they're asked to provide a treatment plan for a patient that is a type 2 diabetic, they're able to perform and give that information. The student is also being evaluated on their bedside technique and ability, and the student is being tested on their ability to diagnose and treat. So I had the opportunity of being a part of one of the OSCEs where I had to play the role of a non-compliant patient, and my physician had to give me a treatment plan and tried to convince me to become compliant. And he was evaluated also on, they were also evaluated on their bedside and chairside technique. Well, one of the forms where we can conduct medical assessments can be done by either a supervising clinician or a senior technician, where we're going to evaluate their clinical skills, communication skills, teamwork, presentation skills, organization, and work habits. The negative about having a supervised clinician or senior tech conduct the assessments in this form is that the evaluation can be very subjective, since a lot of the information may not come from direct observation, but instead comes through secondary sources. For example, patient evaluations or peer evaluations or peer reviews. We can also have what are called structured direct observations. In structured direct observations, we evaluate both communication and clinical skills. It is done using a checklist where the students are given points um, and either given points and or they're assessed with either a pass or a fail. The negative about structured direct observation is that it is very time consuming and selective behaviors are observed rather than habitual behaviors. So basically the evaluator is and the assessor is only looking at certain behaviors. Another manner in which medical providers can be tested is through oral examinations. During oral examination, we test the student's knowledge and clinical reasoning skills and abilities. But the negativity about oral examinations is that they can be very subjectively based. And unfortunately, there might be some biases that may occur during the oral examinations, for example, based on race, sex, gender. It is also very time consuming. It may require the examinators to receive the proper training, and if a summative assessment is going to be performed during the oral examinations, you need to have two examiners present. Another aspect, another way we can do medical educational assessment is through the use of simulators or through simulation. One such form of simulation is basically the creation of a standardized patient. With a standardized patient, we assess the student's clinical needs, their interpersonal behavior, and their communication skills. The downside of this is that sometimes the timing and the settings for that patient may be very unrealistic. To include also the scenario might be unbelievable, and the clinician needs to basically try to think that this is a real patient in order to accomplish the set task. Sometimes students are given a checklist, and students may be penalized if they take shortcuts or if they miss certain critical criteria. Certain high fidelity models or mannequins or actors can also be very expensive. Incognito standardized patients is another form of how we can use simulations with our patients. In this situation, students actually practice, their practice habits are evaluated. The negative about this simulation is that it requires, prior to starting the evaluation, that the patient gives us consent. Also, we need to ensure that we have the proper number of patients with the proper problems that we want our students to evaluate, and it can be very expensive. With the use of high fidelity models, students are tested on actual procedural skills, teamwork use, and simulated clinical scenarios, which cannot be done on real patients. The negative of using high fidelity models is that some of these models may be very unrealistic in appearance or feel. They are very expensive, and it requires a controller that needs to be attentive to what is going on in the scenario and make sure that they are conducting the proper changes as needed. But unfortunately, there might be times where there might be a delay in when the order is given versus when the mannequin responds or reacts. It is also based on a checklist, and the student can get penalized if they take shortcuts or they miss certain critical elements. One of the best ways to evaluate during the medical assessments is through multi-source assessments. During multi-source assessments, evaluations can be done by peers, by actual patients, self-assessment, or through portfolios. When we conduct peer evaluations are done by our fellow students in the same professional field. They are very professional, but the negative about peer evaluations is that a lot of these evaluations, they're confidential, they're anonymous, and you have to convince the trainee to have adequate buy-in to conduct a non-biased evaluation, meaning that if you do not like your fellow student, you're not going to give them a negative mark just because you don't like them. You have to actually do a non-biased evaluation of their performance. Sometimes in the multi-source assessment, we use actual patient evaluations, which it gives the student the ability uh, by gaining the patient's trust and satisfaction. But when it comes to the negative aspect of actual patient evaluations, is that we are looking at the holistic approach or holistic impression versus just a specific analysis on a situation or behavior. And when it comes to customer satisfactions, unless we ask them to write short answers, it can be numerically based, where we have to do a statistical analysis and determine how each staff member performed and rank that in order. But again, in order to get the true assessment of how the staff member did, we need to request short answers from the patient, which they may or may not provide. We can also ask the students to conduct self-assessments. This is where we ask the students themselves, how do they do? And they're able to actually respond with their KSAs and to tell us how good or how bad they believe they did during the evaluation. Well, sometimes it may not necessarily represent the behavior that we're looking for unless we're giving them the proper training and feedback. Or they can just lie and say that they did an awesome job. So their self-evaluation might not be accurate itself. So one of the ways that we handle self-assessment is through debriefs. In these situations, they are done one-on-one. But the best form, or actually not the best form, but one of the final manners in which we can evaluate our medical students or medical needs is through the creation of a portfolio. In the creation portfolio, we look at the student's practical based learning. We look to see what improvements have been made, and it can be system based practice that can be occurred and is basically evaluated. Now, the negative of portfolios is that each student basically can pick their best materials to add their portfolio. They're not going to put the ones that did the worst or not even include that in their portfolio. They're going to do their best work. But at the same time, creating a portfolio can be very time consuming to prepare and to review. So, in summary, we looked at the many different types of assessment tools and assessments that can be done and the manners in which they can be offered. Key thing to remember is whenever we select an assessment tool, it is a two-step process. We first want to select the type of assessment we want it to be, and the second part of it is, and the most important part of it is, we need to select what exactly we want to evaluate. So again, the type of assessment and what we are actually looking at evaluating. We also discussed different types of assessment tools which can be used during medical education. We looked at the pros and cons on the different types of assessments that are out there and available. And last but not least, when it comes to assessments, just like being an instructional system designer, there is not a one size fits all approach. As the designer, one has to pick the best one or best form for evaluation, or you can use more than one style when you're creating your assessment. But again, make it base it on the need and the want. I want to thank everybody for the time. Hopefully you enjoyed the presentation. Have a wonderful day.